Thank you, Bonnie, and my thanks to you, to Michael, to everyone on GBIO's wonderful health policy team. Thank you for helping make sure that in every state or federal health policy decision, there's always a clear and strong voice for patients and consumers. You know, over the past few years, it has been my honor to stand with you against efforts to dismantle the Affordable Care Act. Last year, we sued as well to protect cost-sharing reduction payments that enable tens of thousands of Massachusetts residents to access care on the connector. We've also led the charge nationally to protect against cut-rate, low-quality insurance plans from coming into Massachusetts to rip off and take advantage of customers. And just last month, I had an attorney from my office in Texas defending yet another challenge to the ACA. So we're going to stay in this. We know how critical and important access to health care is. It is a right and not a privilege. Now, you and I know we can't play defense. We're going to continue to try to lead in this state, and that includes by addressing some of the real issues and challenges around cost and distribution that make our system, as strong as it is in many ways compared to other parts of the country with the quality of care, unfair and inefficient and costly. Everyone in this room knows. I just saw how many people put up their hands. You asked me to be here tonight to specifically address the merger, and I respect that and I appreciate that. For more than a year, my team in the office and our antitrust, healthcare, and consumer divisions, our charity lawyers, have been working to review the legal issues and potential claims and to understand what this merger will mean for residents across this state. Over the summer, I wrote to the Health Policy Commission to make clear that I would be looking closely at the merger's impact and potential to raise prices and reduce access to care, particularly for low-income communities and communities of color. Just last month, the HPC referred the merger to my office and asked us to determine if there are enforceable conditions that could address these issues. Even with the limits, I want you to know the following. Limits on what I can say, I want you to know the following. First, I've told my team that any deal has to address the potential for price increases, period. And any conditions have to be clear, enforceable, and guided by our shared goal to keep spending below the state's healthcare cost growth benchmark. Second, enforceable terms in the deal need to protect the community-based health providers that are already affiliated with the BI or Healey, including our community hospitals and community health centers. This is imperative when you talk about people's ability in our communities to access health care. Finally, BI and Healey would have to make meaningful commitments to strengthen access to health care for low-income communities and communities of color. And any deal would have to put real money on the table towards those commitments. We don't know, and I can't say tonight exactly what the end result will be, but our talks are ongoing. I understand where GBIO is coming from and the worthy arguments and critique you have offered, and I appreciate the contributions you have already made to this process. I want to thank everybody in this room for making this transaction a priority. Your advocacy is making a difference, and I will continue to work with you and be with you on this issue and on issues of healthcare as we move forward. Thank you again for everything that you do on so many fronts.